The federal government is in a state of partial shutdown today, October 3rd, after lawmakers on Capitol Hill failed to reach an agreement on a stopgap funding bill. The impasse centers on a partisan dispute over healthcare subsidies. Democrats are insisting on provisions to protect subsidies under the Affordable Care Act, which help millions of Americans afford health insurance. However, Republicans are staunchly opposed, arguing that the Democratic plan would reverse key safeguards put in place earlier this year. At the heart of the disagreement are provisions from the One Big Beautiful Bill Act and the Working Families Tax Cut Act, which were signed into law in July. Republicans contend these laws closed loopholes that allowed taxpayer-funded healthcare subsidies, including Medicaid, Medicare, and ACA benefits, to flow to illegal immigrants and other non-citizens. They argue that any new funding bill must maintain these restrictions. Democrats, on the other hand, say they are simply trying to protect essential health care access for low-income families and that the Republican position is an attack on the Affordable Care Act itself. The effects of this political deadlock are now rippling across the country. The National Park Service, which oversees 474 national monuments, memorials, and parks, is operating with a skeleton crew. More than 9,000 park employees have been furloughed, meaning they are sent home without pay. For visitors, this translates to shuttered information centers, a halt in the issuing of permits for activities like backcountry camping, and a suspension of basic services, including trash collection and restroom maintenance. While parks with open-air access may remain physically accessible, the lack of staff raises concerns about visitor safety and the protection of natural resources. The National Park Service has activated a contingency plan using leftover funds to maintain what it calls a lapse in appropriations. The priority is to ensure the protection of wildlife and federal property, but the agency warns that its capacity is severely limited. This shutdown not only disrupts the plans of tourists, but also deals a significant economic blow to the gateway communities that depend on park visitors for their livelihood. While lawmakers in Washington grapple with domestic spending, attention is also turning to international trade relations, with former President Donald Trump signaling a renewed focus on China. In a post on his Truth Social platform, Mr. Trump stated that China's purchasing of American soybeans will be a primary topic in his upcoming meeting with Chinese leader Xi Jinping. He accused Beijing of deliberately holding back on purchases for negotiating reasons only, a move he says is hurting American soybean farmers. According to the latest U.S. government data available from mid-September, China had not yet made any significant purchases of the new U.S. soybean crop. This issue is a throwback to the trade war that dominated Mr. Trump's first term, where agricultural products, especially soybeans, became a key bargaining chip. China was once the largest buyer of U.S. soybeans, and the halt in purchases had a severe impact on the American heartland. Mr. Trump also reiterated his strategy of using revenue from tariffs on Chinese goods to provide financial aid to farmers affected by the trade dispute. In his statement, he criticized the current Biden administration, accusing it of failing to properly enforce the Phase 1 trade deal that was struck with Beijing during his presidency. That deal included commitments from China to substantially increase its purchases of U.S. goods and services, including agricultural products. The former president's comments bring a contentious economic issue back into the political spotlight, highlighting the ongoing tensions in the U.S.-China trade relationship and its direct impact on American farmers. The debate over government spending also touches on health care, and for many Americans, the most pressing issue remains the personal cost of staying healthy. The high price of prescription drugs continues to create immense challenges for patients, a struggle that often persists, even for those with health insurance and financial stability. The story of one patient, identified only as Sarah, puts a human face on this systemic problem. "If I were 10% less mean or 10% less stubborn, I'd probably be dead," she said. describing a grueling, year-long battle to get the medication she needed. Diagnosed with multiple sclerosis at age 37, Sarah began experiencing debilitating symptoms of the central nervous system disease, which can include vision problems, numbness, weakness, and difficulty walking. An initial medication provided some relief, but as her condition worsened, her doctor prescribed a newer, more effective drug called Kesimpta. While the drug promised to alter the course of her incurable condition and extend her productive life, it came with a prohibitive price tag. What followed was a frustrating odyssey through the American healthcare bureaucracy. Sarah's fight likely involved navigating a maze of insurance denials, prior authorization requirements, and appeals processes, all while battling the symptoms of her illness. Her experience is a stark illustration of the hurdles many patients face. They are forced to become fierce advocates for their own care, spending countless hours on the phone and filling out paperwork, often with no guarantee of success. Sarah's story underscores a broader reality, that a diagnosis is often just the beginning of a fight, not just against a disease, but against a system where access to life-saving medication can depend as much on persistence and paperwork as it does on medical need. And in another development in the healthcare sector, the Food and Drug Administration has taken a step that is once again placing the issue of abortion access at the center of a national debate. The FDA has officially approved another generic version of the abortion drug mifepristone. In a letter dated September 30th, the agency informed the manufacturer, Evita Solutions, that its application for a generic tablet had been approved. Mifepristone is the first of a two-drug regimen used for medication abortions and is approved for use up to 70 days or 10 weeks from the first day of a woman's last menstrual period. The FDA stated that it found Evita Solutions' 200 milligram tablet to be bioequivalent and therapeutically equivalent to the brand-name drug Mifeprex, which is produced by Danco Laboratories. The approval of a new generic is significant because it typically increases competition and drives down prices, which could make medication abortion more affordable and accessible. Evita Solutions confirmed the approval on its website, noting its product would be a low-cost version of the pill. However, the decision was immediately met with criticism from conservative politicians and pro-life organizations. These groups have long opposed the availability of mifepristone, raising concerns about its safety and arguing that it facilitates abortions outside of a clinical setting. The FDA's move comes amid ongoing legal and political battles over the drug's availability across the country, making this approval a new focal point in the contentious post-Roe v. Wade landscape of abortion access in the United States.